Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Why are we seeing greater numbers of obese kids more than ever?
Obesity has become a very common problem for all of us. The reasons are the dramatic shift in our food and social environment over the last 40 years. So we're seeing a lot more calorie-rich foods with added salt, added fat, added sugar. And those are the foods that are generally available to our kids every day, whether it be from home, school, after-school programs. So that's part of the reason. The other problem that we have is that we have really reduced our physical activity as a society. So instead of kids walking to school regularly, they're dropped off by parents, they take the bus. There's limited physical activity in the school day because of increased academic standards. And after school, a lot of kids are spending time with the media. So they're on their tablets, they're on computers, and there's not a lot of opportunities to be moving their bodies on a regular basis, which of course impacts their weight.
Is lack of exercise or poor diet equally to blame?
So those two things really go hand in hand. I think for health, we know that exercise is medicine. So we need to move our bodies to have strong hearts, to have our lungs work well, and it also impacts our weight. So it helps us burn calories, it helps us stay fit and at a healthy weight. But beyond that, the foods we eat really impact our weight significantly. So if we're eating a lot of foods that are dense in calories, they have a lot of added fat, salt, and sugar, then it's going to make our weight go up.
Is this something that equally impacts communities, or are there specific communities that are at greater risk?
We actually have some recent data on that from the Massachusetts Department of Public Health that looked at all the school communities in Massachusetts. And what they found was that most communities, actually all communities, are impacted by this. So in Massachusetts, almost every single community has at least 30% of their kids in school overweight or obese. However, some communities are impacted more significantly, and it tends to be communities that have a lower socioeconomic group. So families that are making less than $37,000 a year are impacted at a higher rate in terms of their obesity. So there definitely are groups that are affected more severely, although I think we can say that every family, everybody in the community is potentially impacted by obesity. We also know that certain ethnic groups are affected more significantly. So if you're African American or you're from a Hispanic background, you are more likely to be obese or overweight.
What are 3 steps parents can take to help their children?
One is form a team. It's so important that families kind of work on this together. So I tell parents, sit down with your kids, say, as a family, we are all going to work towards better health. So it's not just singling out one child or one person that needs to be healthier, it's a whole family problem. The next step is to follow the 5-2-1-0 rule. So that's 5 servings of fruits and vegetables a day, 2 hours or less of screen time, 1 hour of physical activity, and aiming for 0 sweetened beverages like juice, soda, etc. So focusing on milk and water. And the third step is working to make small steps at a time. So if you're going to change your habits, you really need to focus on doing one thing at a time until you sort of incorporate that into your new routine. So very small steps, one at a time, and you can really make an impact for the long term.
When it comes to exercise, are organized sports then better than just general free play?
First of all, a lot of kids now really don't know what it feels like to be physically active. So I'll talk to families, this is what it should feel like when you're moving your body. Your heart rate is up a little bit, you feel your heart beating a little faster, you feel like it's a little harder to talk, to carry a conversation, you feel like you're getting a little sweaty. That's the kind of physical activity that I'm talking about. And there's so many ways to do that. It doesn't have to be organized sports, it doesn't have to be joining a gym. It can be a family walk at a faster pace, it can be running around at the playground, it can be, climbing a tree in your backyard. There's so many opportunities, and I think you have to find ways to make it fun for kids. If it feels like work, if it feels like getting on a treadmill, they don't want to participate, and it's not going to build that lifelong physical activity.
How can the community at large help?
The first thing I think about is making fruits and vegetables affordable and accessible to all our families. Thinking about safe places for our kids to play, places for families to have physical activity together. I think we should work to end the marketing of unhealthy foods to our kids. We should work with our schools to increase physical activity and opportunities for after-school physical activity. So there's very many ways that our community could become more involved in this issue, and we would all be healthier for it.